if you're coming up. Danny, do you have a PowerPoint? No? Okay, so we go straight into Danny's presentation. Are you comfortable with being recorded?
Yeah. No problem. Okay.
What looks like when I do that.
So, I am a nurse, and I became a nurse because when I was about 22, and I had a choice between two jobs. One of them was to read water meters, and the other was to work as a psychiatric aide at the Detroit Psychiatric Institute. And reading water meters paid more, but I had to cut my hair. And I didn't want to cut my hair, so I became a psychiatric nurse's aide, and while working there, they introduced me to nursing, and I became a nurse. Then I became a boss. And as a boss, I would say that I became a boss because I worked in the emergency department of a rural hospital in West Virginia, and I started and taught an advanced cardiac life support course. And when the nurse manager of the ICU left, the nursing staff from the ICU came to me and said, "We want you to apply and be our boss." And I said, "Well, I don't know. I've never been a boss, and I don't know anything about the ICU." And they said, "Well, you'll be a fine boss, and we'll teach you about the ICU." I started working in quality management, and so I became a director, vice president of quality management, and I would say that my proudest moment in quality management was when I worked, one of my gigs was working for a managed care company, Value Behavioral Health, behavioral managed care, and I started a patient advisory council there. While I had another quality management job, and this was a organization that was addiction treatment service in Albany, New York, and we also managed the benefits of the behavioral health benefits for a managed care company, and we needed electronic health record. And for both being a provider and being a managed care company. And so I led the project to research and then implement an electronic health record. So that introduced me to informatics. I've been a caregiver. I've been a caregiver for the end-of-life journeys of my grandmother, my mother, and my son. And I would have to say that, well, let's leave my grandmother out of that because there was nothing funny about her. But my mother was also a person who had zero sense of humor until she was dying of pancreatic cancer. And so one day, I'd never actually seen my mother laugh or mostly crack a smile until she said, "You know, this dying crap is really boring." And she said, it's the 4 Ps: pillow, pills, poop, and piss. And then she added a 5th one a couple weeks later: pain, P for pain. My son, he passed, yesterday was his birthday. He passed of complications and metastatic melanoma, but he was also a fellow that had quite the sense of humor. And what he said was, "I wasn't born with a tattoo on my ass telling me how long I had to live." Actually, we had lots of conversations, he and I, and he would talk about we would talk about superpowers. What are our superpowers? And he said that he and I had the same superpowers, which is accepting what is. I would say that I'm a musician. Oh, I ran out of hats.
Well, you
I
still got
can
one
take care of
there.
that, we have more.
We got hats out
I'm a musician, and the same son, I told him that, I always wanted to be a musician, and he said, well, if you want to be a musician, you got to play. And so I started playing, and I played baritone saxophone. Now, I'm really good at what I do professionally. I'm as good as they come, not so much music. I am enthusiastic and I'm persistent. I don't have a lot of talent, but I really enjoy it. So all of this really, here, quick. So I'm a family man. Put another one on, that's all right. I got enough. So I'm a family man. I've been married 43 years. My wife and I were back to the land hippies, and we built our own house. We had our kids at home. We homeschooled. And I'm an OPA. I'm really proud of that. You see my business card. It says Danny Van Leeuwen, OPA RN MPH. OPA means grandpa. And you got to have the most important credential first. I'm a patient. I have multiple sclerosis. I would say that my biggest challenge these days as a person with a progressive disease is that my mobility has diminished some. I'm falling more. And I did a really big thing last week, which is I bought an electric wheelchair so that I could I can still do 3,500 to 4,000 steps a day, but my wife wants to travel, and she's a serious hiker. She goes to Grand Canyon and goes up and down the Grand Canyon, and I want to travel with her, and I want to be able to do it. So I got myself an electric wheelchair, and I'm trying to look at it as a enhancer, not a crutch, and we'll see. It's a little weird. Okay, so I'm a patient activist. Patient caregiver activist. And so I wear all these hats and I apply all of that to my activism. And I would say that the things that I really care about in my activism is that I care about what works for people. And what works for people is you learn about what works for people from research. And so I do work with PCORI, the Patient-Centered Outcomes Research Institute. I work with CMS, the Center for Medicaid and Medicare Services, and on how do you build an infrastructure to develop patient-centered outcomes. I'm interested in how people make decisions, and I work with some Agency for Healthcare Quality and Research, ARC, and on patient-centered clinical decision support. I'm very much interested in patient ownership and control of their health data, and I'm working on an initiative that's using blockchain technology to help manage the people's access to their data. I think I'm about out of time, so I want to just tell you that underneath all these hats is little Danny Van Leeuwen. And I think it's, I'm very sober that I'm here because I am the child of Holocaust survivors, and they both survived. And my father was a deep closet homosexual and had never been in a relationship with a woman when he married my mom, and I am their second child. So,
Many things to
thank you.
think about there.